So just an update then on emergency general surgery. RQIA, as you will know, the aim was to review the effectiveness of the clinical pathways with a view to identifying any aspects for improvement. The report was published in January 2025. The report itself did not identify any immediate patient safety concerns and identified 10 recommendations that were to be brought forward. And that was agreed in principle by the department and by the trust. Since that, RQA have also attended trust board. If I can just bring you back to some of the particular aspects within the report. They talked about stabilization of the workforce at middle grade, particularly those doctors that I talked about who operate within surgical assessment. They talked about reviewing the need for locums and trying to eradicate locums. Since the review and since the report, we've moved positively in the direction of eradication of locums at that particular grade. And those doctors now do not just work exclusively in Southwest Acute, they actually rotate into Altnagelvin. So what we have is a very resilient workforce where doctors get good supervision and good support from consultants at that level as well. RQA also talked about a very clear clinical audit process. And again, since the report, we've undertaken a continuous audit cycle. And from that audit cycle, we've also identified new pathways for head injury, where patients can have their care in Southwest Acute without the need for transfer to Altnagelvin, where a period of observation is required. But also when we looked at some of the surgical presentations, we identified a number of opportunities for patients not to have to transfer, but to be booked into Southwest Acute Hospital or OMA on an elective basis, given their particular presentation. And that was around patients who required gallbladder surgery and some patients who required incisional drainage of wounds. Work ongoing, and that's not just a two-way process either. We can use those pathways from an Altnagelvin perspective, and we can actually book those patients attending Altnagelvin ED into OMA and Southwest Acute Hospital as well. We've also been very focused on the patient experience piece as well. Our QIA suggested that we could be more purposeful in terms of how we went about that. So we have now written to every patient in January, every patient in February and March to ask them to give us their feedback. And we're in the process at this present minute in time of developing that into core themes. And we will be in a position to share that probably at the next council meeting, if that's okay. Next slide, please, Chris. Oh, sorry, ring fence beds. One of the biggest areas of concern for the population and the patients of Tyrone and Fermanagh was going to ED. Since the 24th of May, the percentage of patients going directly to bed has increased to 79%, and that's very clearly evident in the flow chart that we have. However, it's also important to point out that not every patient will go direct to bed because that is very much based on clinical priority and a decision that is made by the surgeons. However, we are exploring the opportunities within Altnagelvin site to expand the bed capacity to make that a more seamless journey moving forward. Go ahead, Chris. So graph just simply shows the improvements that we've made from the point of view of direct to bed. There can be weeks where it's 100%. There can be other weeks where it dips down depending on pressures. Go ahead, Chris. So SWA rebuild then, obviously very focused on the overnight stay piece, very focused on maximising the opportunities and the operating capacity and capability within Southwest Acute Hospital. And I have to say, I believe we've made very good progress from that perspective. Session numbers increased from 457 in 23-24 to 635 in 24-25, an increase of 38% with 411 more patients being operated on. Really important infrastructure from our perspective, not just from the point of view of utilising the theatres, but given the waits that we have for patients who are awaiting elective surgery. Also very focused on the operating time as well as we move forward. Over the next 6 weeks, we will see Southwest Acute maximise all its capacity and actually on weeks over exceed the commission volumes as we move forward. So we are seeing paediatric surgery there, paediatric dental surgery, special needs dentistry, general surgery, gynae surgery, breast surgery, and more recently, as you'll be aware, ENT surgery came to Southwest Acute as well. Go ahead, Chris.